this week's post, we're going to talk about stomach sensitivity issues and more specifically gluten, since this seems to be a common topic of conversation this week at our office. We've had a number of patients come in to discuss their stomach issues and whether it's associated to gluten or not. So my discussion really kind of focuses basically on the dietary intake of everyone's food sources. Gluten, most people associate with bread and crackers and whatnot, but you have to remember in most common stuff that we take in, whether it's sauces, candies, anything that we're using to marinate food with, typically gluten is hidden in. And so really, if you practice a whole food based lifestyle, that's probably your best way to kind of really regulate what foods are really getting into your system and not getting into your system. So most patients come in and say, hey, I've been having stomach issues for quite a few weeks to months, sometimes abdominal cramping, sometimes I'm having loose stools. There's really a varied amount of kind of chief complaints that people will kind of discuss when it comes to stomach issues. And the first thought is, hey, do I have a gluten sensitivity now? What I typically recommend for most folks is, first thing you got to do is you have to diet journal. There's an assumption, I think, that people will remember the exact foods that they're taking in throughout a daily basis. But the only way to really kind of assess what we're really getting in is to actually physically write it down and then taking a look back to see what each individual ingredient was that could be potentially causing certain stomach issues. Gluten is found in everything, like I said before. So unless we're having severe abdominal cramping with blowout watery stool, the likelihood of that you're having a reaction or even more gluten sensitivity / celiac disease is pretty low. Most people have had issues for years and years and years, and they can usually attribute it back to certain issues that they kind of experienced as a child, and then it has progressively kind of progressed over the years. And those are more along the lines of someone that has celiac sprue. But the question of gluten sensitivity is pretty popular right now. Now, as an advocate of more of a paleo lifestyle or even a whole food plant-based lifestyle, what both kind of have in common is really to kind of make sure that our food sources are whole food, non-processed, and really that we're taking the time to make and create our own food so we know exactly what's coming into our bodies rather than relying on an outside source, which sometimes can be questionable. Recently, David Perlmutter wrote in Grain Brain about the inflammation that's found in gluten and how that can really attribute to a multitude of medical issues, which reading through the literature and reading through that book, I can definitely make heads and tails of it as far as its effect on the human body. I personally have limited my gluten intake tremendously, really, after I stopped eating bread and really moving to a whole food based lifestyle. So as far as treatments and therapies that I will typically recommend for those that are coming with stomach issues is, first, you got to write stuff down. There's no two ways about it. The only way to really kind of assess what you're taking in is to kind of look back and to see exactly how much, what type of food, what the fluid intake was, what the volume intake of water was, or the other stuff that we're taking in. More common for stomach issues really is acid production. And so remember, the human body is designed to be very efficient, and so the simple thought of food will cause acid production in our stomach to kind of prime the system getting ready for food intake. And then it's all the little things that we do throughout the day that can increase the acid. So coffee intake, tea intake, hot spicy foods, I think everyone else knows, but even simple foods like tomatoes, peppermints, spearmint, certain types of spices, certain types of herbs will create an increase in acid production, and that acid production culminated with, let's say, a stressful environment or a glass of wine or something can definitely increase the amount of abdominal pain that some people have, that can translate into sometimes loose stools, where that's more kind of an acid issue rather than a gluten sensitivity issue. If there is a question about gluten sensitivity, the treatment is not medication. The treatment obviously is a complete elimination diet of gluten. So if you're concerned about, hey, am I one of those people that has a slight gluten sensitivity, then you have to eliminate gluten from your diet. And so really it's becoming a very pronounced label reader to find sources of gluten. Gluten is in everything. I mean, it's in sauces, it's in ketchup, it's in candy, it's obviously in the wheat products that we can easily identify. But really, it takes hard work and a lot of effort to find all the sources of gluten and to completely eliminate that from your diet and to see how your body responds. And if you are able to slowly kind of put certain foods in that have traces of gluten, your sensitivity level is probably not as sensitive as you think, and it's probably attributed to another cause, more likely maybe acid production or even the psychosocial, where stress levels increase, acid production increases. You have this transient time where your belly kind of feels off for a little bit, but as the stress levels decrease in your life, whether it's psychological or physical, that your body begins to adjust to that. The third thing, when it comes to stomach issues, I tend to focus on really kind of pushing fluids as a mainstay to kind of help kind of settle the whole system down and moving to a more carbohydrate-based diet for some folks, just because it's simple to digest. I don't recommend a carbohydrate-based diet for 99% of the people I talk to. However, if we're trying to kind of just help calm the stomach system down, I will recommend simple carbohydrates, sweet potato, even mashed potatoes, goldfish crackers, those kinds of things, just for a short period of time. Those are very easy to digest. It doesn't take a lot of work. It doesn't really increase our acid in our stomach to that significant high level that other things can. Just to give the body a chance to kind of reacclimate, if you will, and try to start over. So you're going to read all kinds of varying literature based on what gluten sensitivity is. Is it real? Is it not real? I think the take-home message really for most of us is that if there is a suspicion that you may or may not have, or that you may have gluten sensitivity issues, the first thing you want to do is write things down so you can look back and see exactly what you're taking in. Second thing is you have to hunt down the individual items in the ingredients of your food to see if there is gluten in there. And part three is really an elimination diet. You do that for about 2 weeks, and you kind of see how you feel at the end of the 2 weeks versus the previous 2 weeks. And then if there's significant improvement, it's kind of doing a kind of trial by fire where you individually layer individual foods back in to see if they were to cause issues for you. And every time that you pass in a food test, if you will, that can go back into your daily lifestyle. So hopefully this is a little bit helpful as far as kind of raising some awareness concerning stomach issues, specifically gluten sensitivity stuff. So Flat Rock Health, another education resource. We are your resource for affordable healthcare and upfront pricing. Stay tuned for another Ask the Doctor lecture series update. Thanks. Hope you have a great day.